Welcome to Deus with a new video on health science, enlightening you with knowledge in the field of health and medicine. Today's topic is about the black fungal disease. In India, for last few weeks, there is rising in the cases of black fungal diseases in COVID-19 patients. The infection can occur anytime after COVID-19, either during the hospital stay of several days to a couple of weeks after discharge, with Maharashtra and Gujarat among the worst affected state as per the data released last week on May 22. There are around 8,848 cases of black fungus registered. The main question comes to our mind that why are COVID-19 patients being affected by black fungus infection? Let's try to understand. The current deadly black fungal disease is known as mucormycosis. The disease is caused by the family of fungi called mucorale. Now, fungi is everywhere. They are growing on soil, in vegetables, in the leather wearables, even on our foods. The mortality rate, that is the chances of death from mucormycosis, is around 50%, which may go up to 19% in worst scenario. The black fungus disease is not new. It was there even before COVID-19, but was very rare, and mostly the people who get infected were diabetic patients. Then what made the fungus to attack the COVID-19 patients? Basically, fungal diseases like mucormycosis are opportunistic diseases. Opportunistic diseases affect a person only if the person have a weakened immune system, or have immunodeficiency syndrome, or being treated with immunosuppressive drugs, or have altered microbiome, or maybe because of damage of mucosal layers. If we take a look on the growth of this fungi, the spores, which is reproductive unit capable of giving rise to a new individual when settled on a nutritious substratum. Now, spores are continuously released in the air and can easily migrate to distant places. The air we breathe may have spores that may enter to our lungs. If our food is contaminated with spores, it may reach to our digestive system. The wound, which get exposed in air carrying the spores, provides a gateway for it to enter inside the body. However, now the healthy individuals have a strong immunity which defends the body from the invading microorganisms like bacteria or fungus. While people who are having compromised immune system becomes the victim of these infectious opportunistic diseases that include the black fungus disease mucormycosis. Obviously, we start thinking that why are individuals suffers from compromised immune system? The major reasons may as follows. The first and foremost reason is diabetes. It was noticed that among the 95% of patients who developed fungal infections after COVID were diabetic, and 67% had uncontrolled blood sugar level, indicating the importance of maintaining healthy blood glucose level. The next reason is unnecessary use of steroids. Steroids have anti-inflammatory property, and therefore it is used to reduce the inflammation triggered due to the viral infection in cases like COVID. But it should also be noted that steroid suppresses the immune system and also it causes raise in blood glucose. So if someone is diabetic or have uncontrolled blood glucose level, usage of steroid may worsen the situation, making the individual susceptible to opportunistic infections including mucormycosis. Patients undergoing chemotherapy where the drug may suppress the immune system provide a safe haven for the fungal spores to thrive. Patients undergone transplantation generally provided with immune suppressive drugs which may lead to secondary infections like mucormycosis. Immunomodulating medicines like tocilizumab is used as anti-inflammatory agent, though it reduces inflammation in COVID patients, but meanwhile it eases the fungal spores to grow in the human tissue. There are other potential reasons that also cannot be neglected. One of the potential reasons is overusage of zinc. Yes, you heard right, it's zinc, which is used to strengthen the immune system. But excess of zinc in blood along with usage of steroid actually helps the fungus to grow. The next is inhalation of hot steam, which is advised by WhatsApp gurus. Steam at 70 or 80 Celsius can damage the mucosal lining of the nasal cavity. The mucosal lining actually acts as a barrier, protecting the nasal cavity from microorganisms present in the air. Damage of the barrier makes the fungal spores easy to enter inside the nasal region. We cannot neglect the usage of contaminated water used in the humidifier along with oxygen given to the COVID patients. The contaminated water may harbor lots of microorganisms, including fungal spores. Further, the oxygen cylinder used were of non-medical grade. If someone gets infected with the black fungus spore, the symptom appears in 5 to 7 days. Now, what are the symptoms if someone gets infected? Now, it depends upon which region we are talking about. For example, symptoms of rhinocerebral mucormycosis, which appears in sinus and brain, may be one side facial swelling, headache, nasal or sinus congestion, black lesions of nasal bridge or upper inside of mouth that quickly become more severe. It may also include fever. The symptoms for pulmonary mucormycosis include fever, cough, chest pain, shortness of breath. Cutaneous mucormycosis that infect the skin may look like blister or ulcer, and the affected area may turn black. Other symptoms include pain, vomit, excessive redness, or swelling around the wound. Gastrointestinal mucormycosis symptoms include abdominal pain, nausea, and vomiting. Includes gastrointestinal bleeding. How mucormycosis is diagnosed? Now, the diagnosis depends upon first the area of infection. Mostly, the samples of affected tissue is analyzed in a laboratory for evidence of mucormycosis, and a fungal culture is done. Imaging tests such as CT scans of the lungs and sinuses and other body parts may also be helpful. So, is the disease communicable? The good news is that the disease is not communicable. That means it does not spread from one person to another person as it happens in the COVID-19 case. Then, how mucormycosis is treated? Mucormycosis is treated using antifungal medications like amphotericin B intravenously. Some medications can also be given orally. In severity, the patients have to undergo surgical treatment that may remove the infected parts. So, at last, what's the takeaway message? Takeaway message: diabetic patients should take care of their blood sugar. Avoid using steroid unnecessarily. Avoid using antibiotics unnecessarily. Maintaining good hygiene is very important. See you next video